Well, it's nice to finally meet you visually. We've chatted a couple times over the phone, making appointments and moving appointments and getting scheduled to chat. So, such a pleasure and thank you so much.
Oh, well, I'll tell you what, I really enjoy the services that Bryan provides. So
And I think Brian is one of the best people.
he is definitely.
I can't wait to hear about your experience working with him. How long have you been a client of Big Sun?
I think it's either been 3 or 4 years since I started. I actually had gone for acupuncture and then was actually referred over by the acupuncturist and my hypnotherapist to Bryan. I had been having back issues for years, and in particular, it was to the point I couldn't even turn to, to pick up something from the back seat of my car without excruciating pain. And it was a rib that kept on popping out. And I had had it taped. I had had a massage therapist work on it, and and it wouldn't stay in. I mean, it just popped right back out. My husband could put it back in, but then it just popped right back out. And since I've been going to Bryan, it has it has stayed in, and I have full movement. And so that's how it initially started. But there have been some interesting and really wonderful developments along the way, especially in the last 6 months. So um, I suffer from severe hypertension. And even with medications, my blood pressures were running 180 over 100. If I took lots and lots of medications, we finally got it down to like 140 over 90. But then my kidneys started failing
Wow.
and I was washing out my potassium. I'm actually in the medical field. I'm a paramedic. So these are very, very serious things. And then about 6 months ago, during one of our sessions, um, there were some other um, issues with the neck area and so forth. And he actually did some cupping, and he actually cupped the carotid artery separately. And the blood, I could actually feel the blood pressure dropping as he did that. He has been doing it on a regular basis, and I am off blood pressure medicines altogether, and doing my breathing exercises and so forth. Um, but I had gone through the apnea machine and thinking it was the apnea that was causing the high blood pressure, which it can, but it wasn't fixing anything. The medications were washing out my potassium in order for it to work halfway decently. But my average blood pressure without medicines is about 140 over 85, and that's without medicines.
Wow.
Um, and with medicines, I couldn't get it that low. So I'm satisfied.
I honestly, when you said that, I just got like chills all through my body. Brian said, "Talk to Mary G. Talk to Mary G. You got to get her on the phone. Like she's great." Da da da. And you send us business all the time.
I
And
do. I actually, I have a team at work, and one of the things for my birthday tradition is I cook for everybody, and then I give a gift to everybody at my party instead of the other way around, because it's a celebration of my life and my Thanksgiving. It's called Wopila in Lakota. And so for my Wopila, for my birthday this year, I actually got uh, gift certificates for all of my team members um, that have gone through, uh, and they've all loved it. They've all really loved it. And then my sister, who's had a lot of issues going on and so forth, and she went and she called me one day. She had gone. I had bought her a package, and she called me one day. And she asked me, it's like all of a sudden when he was doing, it was her third session and he was doing it, and it's like everything became crystal clear to her what she needed to do.
hmm,
and she had been swimming through mud, as I put it. And so that's one of the advantages of doing therapy like this, is it treats not just the physical things, but the emotional things that are tied to the physical things. And I'm also a hypnotherapist. I'm also a certified massage therapist. I didn't ever practice as a massage therapist, but I took the class and I have done a few. Um, and the energy work um, is one of the things that I've been studying for most of my life. So that's really interesting. I actually work in Western medicine as a paramedic, and I actually teach paramedicine. So it's kind of a strange combination that I have. Um, but the blood pressure thing, I have been plagued by this for almost 3 years with extremely high. I mean, to the point where they can't do dental work because my blood pressure is too high, and that's on the medication. So the fact that I could actually feel it bottoming out, um, dropping when he was doing that, it was amazing. And he's kept it up. And I take my blood pressure 3 times a day. I have to, because of the high blood pressure issue.
Yeah.
And it's been amazing. It actually stays down for about a week and a half before it starts to climb a little bit. And I have my appointment every 2 weeks. So that works great.
How did you first of all, I love your background and your experience. How interesting, and really, you're kind of a perfect client for Bryan, because he is such a pragmatist and such a realist, and he really, has such a really firm grasp, sometimes uncomfortably firm grasp on the actual physical, pieces of the body and what's going on and all those things. But that energetic healing side of it, it really can't be separated. And, I think that's something that he doesn't really talk about too much. And so it's so interesting to hear, your experience and your sister's experience. But I'm curious how did the conversation and treatment protocol for your blood pressure come about? You know,
It actually didn't. I carry my tenseness in my. I,
yeah,
I carry the emotions in
yeah,
the neck and shoulders, and I always have.
yeah.
I'm also a certified hypnotherapist, um, that actually deals with hypnotherapy that combines the body and the mind
Hmm.
together, because
Hmm.
our neurology is stored in our body in
Hmm.
different
Hmm.
ways.
Hmm.
And so he
Yep.
was doing, and he was going through this, and it had his, he was treating the tenseness in there. But when he cupped the carotid, and he said he was cupping the carotid, which makes sense. And as a paramedic, one of the things that we do to lower the heart rate, lower the blood pressure, is to do carotid massages, vagal maneuvers, in other words,
Hmm.
um, which lowers the heart rate, and it does lower the blood pressure slightly, temporarily. And and he put that over the carotid, and I could actually feel, because I can feel when the blood pressure is going back to normal, and I can feel when it's bottoming out. I've fallen 3 times in the last 3 years, because the blood pressure medicine will all of a sudden work temporarily, and then my blood pressure was too low,
Mm.
and we couldn't get it regulated. But when he did that and released the energy
Hmm.
blockages in the carotids, um, I could just feel it dropping. So of course I took my blood pressure at home, and it was absolutely normal. It was 119 over 72.
Wow.
I and So I actually ended up, I weaned myself off watching this. I actually weaned myself off of the blood pressure medicines. So I am not on any blood pressure medicines, and I have a better blood pressure than I was on the blood pressure medicines.
Wow. It's
So
sort of miraculous. It's really wonderful. He didn't tell me
well,
any of this, by the way.
oh yeah, yes, and the thing about it is, our body reflects what's going on emotionally.
Yeah.
and you can't separate. Everybody wants to separate the emotional from the physical, but it's combined. You know, I know the physical reason for why my back was weak and that rib kept on popping out. A friend of mine has the same thing. I've been loading and unloading stretchers
Hmm.
for years, and it's only on one side. But there was an emotional component too, that you have to strengthen uh, both in the same, and that's why I do the hypnotherapy also. And I do self-hypnosis and I do yoga. So just the combination just really works well. And dealing with Bryan, working on the physical slash emotional area where he can pinpoint the physical things that are going on. If you correct one thing, it'll correct the other and vice versa.
Hmm.
So you have to treat it wholly.
Yeah. Yeah, absolutely. I don't want to keep you too long, but I did want to ask, you mentioned the breathing protocols and exercises. Is that something that Brian gave
Right?
you as
Yeah.
homework?
Yes, he gives me homework, and it has really worked. And I actually uh, tried to teach my husband, and he when he does it, he can actually move better when he does it.
That's amazing. So can you tell me which breathing techniques?
Well, it's the head movement, trying to convince my body that it's okay to go from side to side and do it with the breathing
Oh, yeah,
and
yeah.
up and down, getting letting the body know it's still okay to move your neck. And as I was watching my little puppies every morning, when they get up, they stretch, and little children, little babies, they get up and stretch.
Yeah.
Grown-ups forget to get up and stretch, and
Yeah.
then you're stiff all day.
Yeah. We tend to get up like, uh,
Yeah, and we don't.
again.
And yeah, whereas if we started our day stretching, and has me doing them 3 times a day,
Uh,
whether I'm in the car, most of them I can do I do a lot of driving. I work 200 miles away from one of my jobs, and uh, and then I do a lot of traveling. So I'll do those exercises while I'm driving.
well, I love that you're, recruiting your husband and sharing, spreading the wealth and, sharing with people and promoting that health. Of course, I can tell that that is one of your core values, right? That, you want to see people get better and when we internalize that and really commit to our own practice and do the work and stuff, you know,
It's amazing
it's
what can
amazing.
happen.
It's amazing.
And I work in a field in emergency medicine, and I'm not a big proponent of a lot of the medications that they use in Western medicine. I'm okay with the ones that I have in my box, which are 8 out of the 10 most dangerous drugs in the used I carry. But they are for emergency.
Yeah.
But when you're looking at long term, a lot of these medications, what they do is they band aid the problem and you don't fix the actual problem. So it continues to break down other parts.
Yeah, and in
And
Western medicine, we're still, like you said, we're still compartmentalizing so much. It's like,
exactly.
just fix this thing and kind of don't ever ask questions about the
Right.
psychospiritual, the emotional, and why the pattern continues to return. And um,
Exactly. And if you have an infection in your foot and it's hurting, and you just want pain medicine for it to quit hurting, well, pain is a signal. It's a signal that you need to change something.
yeah,
Emotional pain, physical pain, depression, it's a sign that you need to change something in your life so you don't have that anymore.
yeah,
You need to fix the problem. And throwing a bunch of antidepressants or pain medicines, chronic pain medicines at something, it it's not fixing the problem, so the problem is going to continuously get worse.
yes,
And that's the biggest issue I have with Western medicine. And it's, my doctor and I'm part of my healthcare team. So when I go into the doctor and I talk to him, I actually have to come because they only allow me 15 minutes. So I have to address everything that I need to have addressed. So I actually write it down. Um, I'm also medically competent. There are a lot of people that don't know what to ask, and they go down the completely wrong path. Um, my husband had a hip that was going bad, and he had gone in 4 times, 5 times. Finally, I went in with him, and they'd start asking questions. And sometimes doctors don't know how to ask questions either because they're on the other side. And as a paramedic, I bridged that gap. So they started, well, does your knee hurt? Well, does your foot? Well, now we've gone down a completely wrong path. And I looked at the doctor. I said, he's had 3 non-traumatic back injuries in the last year. This is a man who goes to Walmart 3 times a day. He only gets out of the house once a month with excruciating pain, or once a week. And they finally, so what was the problem? The problem was the hip. So they got the hip replaced, and let's see, he threw out his cane, all of the equipment that he was supposed to use for it that he insisted we get. 3 days after he had his hip replaced, he was driving, he was doing everything without pain meds. A week after he had his hip replaced, he hiked up Bear Butte, which is a 5-mile hike, with no problem. So giving him pain medicine was not going to do anything at all. And pain medicine will cover up the pain, and so that you're doing things that you shouldn't be doing,
Right.
making it worse.
Right. Right.
And so that's what I like about being part of my own healthcare team and having Bryan as part of my healthcare team.
One thing that comes out so much, and I love it because I'm hearing it coming from you too, is to do the work, and not just the work of doing the exercises and coming into clinic and all those things, which is, of course, you have to do that too, but also really looking at what's going on and examining that, and wanting to get better. And so kudos to you, and we so appreciate you. People don't really know sometimes what Bryan is up to, and they don't know until they come in, and then they kind of have to get past the, "Okay, this isn't really easy or comfortable." We kind of
Well,
tend.
it is, I will admit, the first 4 or 5 sessions that I had with him, during the session, it was incredibly painful because he was touching areas that were
Yeah,
so, damaged
yeah,
that it's going to. But, within an hour of finishing it, I would go in, I would just, okay, I can breathe through it. I've been through childbirth. I can do this. And, and, you have to go through the pain in order to get to the other side.
yeah,
And the first 4 or 5, my body was so resistant to everything that it was incredibly, and I would have to just do deep breathing the entire session, knowing that this is what I needed in order to fix the problem. A feel-good massage is not going to do it. But by working through a problem, addressing it, and facing everything that goes along with it, physically, mentally, emotionally, spiritually, you come out the other side without any of the residue.
yeah,
And I think that's an important fact, that sometimes, when you break a leg, it hurts. And I have patients all the time that come and, they've been to the hospital, they have an infection, the doctor gave them medicine, and they go home. They take the medicine and they still feel rotten. Well, they're sick. And it's going to take a week to 10 days for this to pass. That's all there is to it. There is no quick fix to make it so that you can go to work tomorrow and that you can go, you injure a muscle, the pain is there to prevent you from using it so that it will heal.
yeah,
And if you cover up the pain, then it's not going to be able to heal because you're still using it when you shouldn't be.
yeah.
And so I will admit, the first 3 or 4 sessions, I basically did my deep breathing, my Lamaze through the session. But within, an hour after that was the most painful part. But then within an hour afterwards, it was amazing that I was getting more and more pain relief from the normal everyday pain, which is wonderful.
Yeah.
And the price is minimal compared to the relief you get. I
Oh,
mean, that's what people don't realize.
yeah. I mean, Brian, I know several people that he's, helped them avoid massive surgeries. So, I mean, just that alone is like, oh my God, not only the cost, but the time value to not have to sacrifice that life and your
Absolutely.
body and all those things. So, any,
And you're fixing it naturally. Yeah,
yeah,
I mean,
yeah.
if you have an appendicitis, I have to go to the Western medicine man and have the appendix removed, if it's on the verge of rupture. But a lot of these soft tissue injuries can really benefit from the natural healing and speeding up of the natural healing.
Yeah, absolutely. Well, thanks so much. I'm gonna let you go as
Okay,
Zoom's gonna cut us off anyway in a minute, but
okay,
such a pleasure, and I hope you have a wonderful day, and we'll chat with you again soon, I'm sure sometime.
okay. Thank you.
Thanks, Mary. All right.
Goodbye.